we've done quite a few shows here on Nutramedica around the immune system, modulating the immune system, and clearly the role that, nutrition, supplements, lifestyle play in maintaining a healthy immune system. So perhaps could you talk a little bit about the difference between an infant's immune system and an adult's immune system? Because I think that probably may not be entirely clear for our viewers.
So an infant is born with Th2. So when we talk about Th1, Th2, okay. Th1 is responsible for making antibodies to viruses and bacteria. An infant is born with Th2. Th2 is responsible for making antibodies to allergens. So as the infant develops, the Th1 aspect of the immune system starts to come turning on around 6 months, really robust, more so around 9 to 12 months. And so there is literature that's looking at from cytokine, the deficiency of certain cytokines, but also the seroconversion of an infant taking that antibody and making long-term protection from that antigen. You can vaccinate a child at 2, 4, 6, and they will make antibodies to those viruses and bacteria, but that's because we've stimulated with an adjuvant. So you use an adjuvant to stimulate the immune system to respond to the antigen. It does, but it's very short-lived. They make it and declines. They make it, declines, make it, declines. You repeat what you do at 2, 4, 6 months, you repeat at 12, at 15 or 18 months, depending which province or country you're in. So it's a lot of repeat that you're doing. There's not a whole lot of vaccines per se, certainly more than when you or I got vaccinated, but we repeat them. And so then you'll get more sustained antibody protection at 12 and then at 15 months. So there is infants' immune systems develop. They're not born with an immune system that knows exactly what to do, because there's a bit of a protective mechanism around that. Making an antibody to a virus and or a bacteria is inflammatory. So the infant's body isn't ready to be inflamed that way. They don't have the turn-off switches as robust as an adult does yet. It's relying on mom's breast milk. The infant relies on passive immunity. So mama provides those antibodies for protection. And as through breastfeeding, if an infant has contracted something, an antigen is within its mouth, it will retroactively go up into the breast, and the mother's body will recognize that and then bring on those antibodies to protect its baby. So there is a really distinct difference, a majorly distinct difference from an infant versus an adult. And then elderly, it's simply as we age, there's just a decline in the robustness of the immune system.
I hope you enjoyed that highlight from a recent program on Nutramedica. If you want to get access to our full-length shows and live interactive events, you'll need to register as a healthcare professional at Nutramedica.org. To stay up to date with our latest programs, go ahead and subscribe to this YouTube channel. And don't forget to hit that notification bell. We'll see you soon at Nutramedica.org.